My name is Tobin Copley. I'm with the BC CDC. I'm one of the 5 regional injury prevention leads around the province. I'm placed within the Fraser Health region. I'm going to be talking about our BC Vision Zero and Road Safety Grant Program today. This is going to be the 4th year of this provincial program. And I'm really excited to be able to share information about it with you today. Moody, BC in Canada. I'm the lead responsible for the Fraser Health region, which provides care across the traditional, ancestral, and unceded territories of the Coast Salish and Nlaka'pamux nations, and is home to 6 Métis chartered communities. The Vision Zero program we're going to be talking about today spans the territory colonially known as the province of British Columbia, and the injury prevention leads for each of BC's regional health authorities are also participating in this webinar, and they'll be offering their own land acknowledgements later in the webinar. For everyone else, I invite you to share your land acknowledgements in the chat. One second here. Okay, so today's webinar is broken into 4 parts. First, I'll outline the burden of road-related injury and why we're offering the grant. Then I'll talk about the priorities for the program. We'll give some examples of past projects. Then I'll provide some tips for writing a competitive application. And then finally, we hope to have some time for questions and answers at the end of the webinar. So you might be asking, why is public health in the road safety grant business? And simply put, it's because the Vision Zero grants we're going to be talking about today support a key public health area. Road-related injuries and fatalities are one of the 3 focus priority areas for our injury prevention program. Why is it? Well, as you can see here, the burden of injury from traffic crashes is high. Not only are injuries the leading cause of death for people in from age 1 to 44 in BC, but traffic crashes are a leading cause of deaths and hospitalizations within the statistic. Also, because these injuries impact our healthcare system and patient flows, it's really important because it's hundreds of millions of dollars in direct treatment costs, in addition to all the load that these crashes put on our already strained healthcare system. And importantly, the burden of injury from traffic crashes isn't shared equitably across the population. This graph shows just one stark example of this inequity. While we've made massive gains in safety for motor vehicle occupants over the last 20 years, these gains haven't been shared by unprotected road users, such as people walking and cycling. In health, we're used to dealing with what you might call wicked problems. And these are problems for which we don't have good options to address the issue or improve outcomes. Road safety is not one of these issues. We have the research, we have the evidence, we know what to do. The issue is making it a priority and acting. So the concept of Vision Zero and the grant program we're talking about today is one way we can make evidence-informed improvements in road safety and address the persisting issue of traffic-related injuries for unprotected road users. Vision Zero is a framework to guide action to address the toll of road-related injuries. Our grant program is named Vision Zero because we're looking for project proposals that align with these principles. One way that Vision Zero can be adopted in a meaningful form is through a commitment to safe system thinking. Vision Zero and safe system thinking are about creating a system that works automatically and by design to make road user deaths and serious injuries nearly impossible outcomes. This approach means implementing evidence-based measures for safe drivers, safe speeds, safe roads, and safe vehicles. As you can see from points on this slide, the Vision Zero approach represents a fundamental shift in thinking compared to the traditional approach to road safety. It's important to emphasize that Vision Zero is not about eliminating all crashes. the focus is on the elimination of serious injuries and deaths. Importantly, Vision Zero recognizes the inherent fallibility of humans, which is why a safe system has multiple layers of safety. About Vision Zero, it can be said that in every situation, a person might fail, but the road system should not. In the Vision Zero perspective, road crashes are not accidents. They're system failures, and those can be managed and reduced in systematic ways. This grant program is intended to help communities make small system changes to improve the road safety from a systems perspective, thereby reducing these kinds of system failures. One of the important considerations for any actions we take, especially with smaller grants, such as the Vision Zero grant, is the issue of effectiveness. One way to think about the potential effectiveness of an intervention is to frame it within what is known as a hierarchy of controls. And this is shown here in this slide here, and we've included some examples on the right side to show you how some of the common road safety interventions can be slotted into each level of the model. In the Vision Zero approach, preference is given to those interventions that can be placed higher within the hierarchy of controls. All other things being equal, we'll want to prioritize elimination of the hazard over educating users about how to live more safely with the hazard. So, for example, thinking about proposals to improve safety for pedestrians crossing a street, we can anticipate that our grant adjudication committee will rank proposals that slow traffic and improve lighting at crosswalks higher than proposals that tell people to wear brighter reflective clothing. Or looking at speed management and recognizing the fundamental role of vehicle speed in crash risk and injury severity, our adjudicators would generally prioritize design changes intended to calm traffic, such as narrowing travel lanes, decreasing an intersection corner radius, or installing speed humps, rather than just posting signs that tell drivers to slow down. So the Vision Zero program helps communities make small steps towards these system changes. These grants provide up to $20,000 for each project. It's aimed at protecting vulnerable road users, that is, people who walk or cycle or scoot when they travel around their communities. People can use these funds to make infrastructural improvements to roadways, to enact policies or enforcement measures, to launch educational campaigns, or carry out any other innovative projects that make traveling safer and more equitable. To date, the program has awarded nearly $2.5 million for 156 projects across BC. In this program, we have two streams of funding available. Stream 1 is a general community stream. Stream 2 is what we call the indigenous-led funding stream. The activities that are eligible for funding in Stream 1 include, but aren't limited to, design and installation of innovative low-cost road improvements that increase the safety of vulnerable road users. In Stream 2, that is for activities improvements such as those in Stream 1, they're eligible, in addition to developmental initiatives such as road safety planning, community consultations, or partner engagement. We also fund initiatives that are aimed to address specific issues such as driver training or impaired driving or a bike share program to improve active transportation. Overall, the intent is to focus on the protection and safety of vulnerable road users. We want to support equity with priority given to projects serving or led by socially and or economically disadvantaged communities. We want to help organizations do work beyond that which they would normally do. We want to move the needle in a manner of thinking. This means that projects that are already budgeted and improved will be ranked by our adjudication committee less highly than projects that take on work that would have otherwise not been done, or work that significantly extends the scope of approved work, or improves important protective work to be taken on significantly sooner than it would have in the absence of the funding. We want to promote community safety actions that also bring co-benefits to related areas of interest to population health, such as increasing physical activity, increasing community connectedness, or addressing climate change. One thing I want to mention and really emphasize here is that applications for any roads that are under MOTI, that is Ministry of Transportation and Infrastructure jurisdiction, are not eligible. And that's a really important point. So if you're unsure if the location you're considering for your project is on a road under MOTI jurisdiction, use the provincial mapping tool to find out. And we have a link in the frequently asked questions section on the Vision Zero BC website to help you find out. Just click on the item, how do I find out whether a road is under BC Ministry of Transportation and Infrastructure's jurisdiction, and follow the instructions that follow. I've got an arrow pointing to where that is on our FAQ page. Once you've loaded the provincial IMAP tool via the links from our FAQ, and you follow the instructions in order to show the needed map layers, you'll be able to see which roads are under MOTI jurisdiction. As you can see from this example here, which is in Agassiz in the Eastern Fraser Valley, the bold brown lines show how MOTI has responsibility for some of these roads, including some of the roads that run right through downtown, which some people might not expect. That would be under the Ministry of Highways. So do check that out, especially in smaller towns. If it is on a MOTI road, then unfortunately, it's not eligible for funding through this grant. But please reach out to your regional injury prevention lead to discuss other options for addressing your safety issue. If you have any questions about whether your grant is eligible for funding, or whether your organization is eligible for funding from the grant, please reach out to the lead in your region. These are the main areas, main groups that are eligible now. But as I say, any questions, just reach out to us. These are the key deadlines right here for the Vision Zero grant. The most important right now is the application deadline, which is 11:59 p.m. Pacific time on Friday, November 29th. Once that deadline passes and we've received the applications, each of the 5 health regions around the province have their own regional adjudication committees. They will review their applications through December and into January, and the successful candidates will be notified in February next year. The successful projects, it's important to note, can't start their activities before April 1st, and you've got to be finished no later than March 31st of 2026. We've really tried to keep the reporting requirements very simple. So we have a simple, short midterm report that's required in September, and a final report due after the project completes, which should again be no later than the end of the final report should be no later than the end of April 2026. So I've mentioned that we have these regional leads around the province several times already. So now you're going to get to hear from each of them over the next few minutes. I've asked the lead from each health region to highlight one of the Vision Zero projects they've funded in the past few years, just to give you a sense of the kind of projects that have successfully applied for funding, and importantly, how the project addresses grant priority issues and some of the project's successes and challenges. As you might imagine, it's difficult to choose just one project each from each region, given that we've funded over 150 projects all across the province. But hopefully this will give you a feel for the variety of ideas that have received some funding. So we'll start at the top of the map and work our way down. So first up is Northern Health.
Thanks, Tobin. So my name is Natasha Thorne, and I'm a regional nursing lead for injury prevention, and I support Northern Health. So the top of the map, like Tobin said. I'd like to start by acknowledging with gratitude and respect that I'm calling in from the traditional, ancestral, and unceded territory of the Lheidli First Nation. I'd also like to acknowledge that this is the chosen home of the Prince George Métis Community Association. So, the Northern Health Project I'm pleased to highlight today is in the village of Dajingiz, which is a community on the island of Haida Gwaii. Dajingiz is a project. The Dajingiz project is working on protecting vulnerable road users through 2 parts. The first is to improve the faded crosswalk in the main part of town with an upgraded thermoplastic crosswalk. And the second is to focus efforts on reducing speed in both Dajingid and across Haida Gwaii. So reducing speeds is being addressed through installing two factors. The first is new speed limit signs in alleys and using 2 mobile speed reader boards for the RCMP and other local governments on the island to use. So to increase safety in alleyways, in the village, Dajingid started with a community survey to ask the public if they supported a reduced speed limit in these laneways. The community responded with significant support to reduce the speed to 20 kilometers per hour. And the Vision Zero funds were used to purchase the signs you can see on the slide. As for the 2 speed reader boards, the village has partnered with RCMP and other local government on the island to use the boards to evaluate the need for enhanced enforcement and a reminder to drivers to slow down. So these 2 factors, reducing speeds and improving infrastructures like crosswalks, are very important steps to protect vulnerable road users and encourage active transportation on Haida Gwaii. And I will pass it back to Tobin.
Okay, thank you, Natasha. Next up, we have Interior Health.
Hello, everyone. My name is Anita Ely. I'm the Specialist Environmental Health Officer with Interior Health's Healthy Community Development Team. I'm actually here today covering for Cheyenne Baines, who's the injury prevention lead, similar to Tobin, but for Interior Health, and she's away today. And although I'm not the injury prevention lead, I have participated in the Vision Zero program for all the years that it's been running. So I'm pleased to be here. And before I begin, I just want to acknowledge that in this part of BC, there are 8 traditional, ancestral, and unceded territories to which Interior Health provides services. So the Dakel Dene, the Chinaha, the Inglakatma, the Stetlium, the Siilk, the Sanayaks, and Shequetin, on whose territory that I'm located here in Salmon Arm. And lastly, the Silcotin, which is the territory in which the project I'll be sharing today is located. There are also 15 chartered Métis communities in this region. Okay, so Claytinco is a rural community that is the largest community of the Silcotin Nation, and it's located about 100 kilometers west of Williams Lake in the Caribou region, so it's quite remote. Speeding along with unsafe driving of cars, trucks, ATVs, and dirt bikes were identified as the biggest problem. There's been a fatality in the community, as well as other injuries, and just reluctance for vulnerable road users to use the roads. The roads in the community are all gravel, and you can see a overhead picture of the community on the right-hand side there. Inverse speed bumps were chosen as an effective means to change the road network system to slow down vehicles and ATVs. There was also some other initiatives that were included, such as signage and education. This has a direct link to equity because, as I mentioned, active transportation is the only means of transportation for many community members, and very few people dare to walk on the roads. And this limited their movement in their community to access services and to go about their daily lives. The challenge, one of the challenges was that the proposal that was put forward was initially to install speed bumps. However, raised pumps, they can't be installed on gravel roads. And so this was a challenge. And so through the Vision Zero project, a road safety engineer was brought in to review the challenges of the community and the context of the community. And then he recommended inverse speed bumps, which is like under instead of over, be installed in select locations along the relatively long straight stretches to keep speeds at the posted speed limit of 30 kilometers per hour. And they were installed. So all of those little blue lines on the picture to the side were the recommended locations. I don't believe they have the funding to put all of those in, but quite a few of them have already been installed along with signage to go along with it. And the great thing is that for this community, inverse humps can be maintained by the community staff at a relatively low cost. So that's the project that we wanted to share. Thanks.
Thank you, Anita. And next we'll go to the island.
Oh, sorry, my microphone was muted. Good morning, everyone. I'm calling from the North Island, the traditional unceded territory of the Lake Lekwitaq speaking people of the Wiwe-Kai, the Wiwe-Kum, and the Kwika. So colonial name of Campbell River. I am the North Island Injury Prevention Lead for Vancouver Island and the lead for the Vision Zero grant program. The program that, or the project that I wanted to highlight today is in the city of Nanaimo. It was a raised crosswalk that was added near Ecole Ocean School, and the problem that they are addressing with this crosswalk was high traffic volumes, and also that the traffic speeds were much higher than optimal. So they consider with the 85th percentile speeds, anything over 7 kilometers an hour higher than posted speeds is problematic. And then in this intersection, they were seeing actually during school drop-off that speeds were around 12 kilometers higher than the 30-kilometer limit, and that outside of those times, it was upwards of 15 kilometers an hour higher. So quite problematic speeds in this area. They really looked at this as part of a larger corridor improvement project to increase safety for vulnerable road users. So we're really, with this project, looking at increasing active transportation and making the area safer for users of pedestrians, cyclists, and other micromobility users. And one thing I really liked about this project as well is that they were using recommendations from the active transportation design guidelines. The project didn't have any significant challenges. One thing that was noted was delays due to weather, but they did still manage to finish the project during the before the project deadline. So we give a year for these projects, but I guess we can note too that we can be flexible if there are challenges with that. And another thing I want to highlight is how they shared how this project is often really helpful to make larger projects more robust and fill in opportunities where if a project is over cost and they have an additional piece that they want to implement that is not within the budget, that then this allows that to happen. So that's an example of this project where this raised crosswalk was fully funded through our Vision Zero grant. And thank you, that's it.
Awesome, thank you, Kim. And next we go to Vancouver Coastal Health.
Hi, everyone. My name is Joanne Sadler, and I'm one of the injury prevention leads within Vancouver Coastal Health. And I'm actually stepping in for my colleague Kirby today, who is the VCH program lead for the Vision Zero grant program. I'd just like to acknowledge that I'm calling in from the unceded traditional territories of the Musqueam, Squamish, and Tsleil-Waututh nations. So the project we want to highlight today is a Stream 2 initiative from the 2022 grant cycle. So Newhawk Nation applied for funding to build a series of bus shelters in their community. And the primary objective of this project was to build safe and visible shelters to protect users of a new bus route that ran between 2 communities in their school district. So Newhawk Nation is in a rural, remote coastal region. It's home to active wildlife. They cited grizzlies as a big issue, intense storms, and the physical surroundings there can cause visibility challenges at many times during the year for drivers. So the bus shelters were intended to protect users of the bus route and encourage community members to use this new form of transit, which aligns with the community's strategic plan to increase capacity and health and safety measures for all ages. So the Vision Zero grant funds were combined with funding from other organizations, and they built a network of 14 bus shelters on reserve, which is fantastic. And the project included engagement with local homeowners and it was reported that they were all very supportive of this project. And then phase 2 of the project, which is outside of this funding, was for young, inspiring artists in the community to paint the bus shelters with Newhawk designs. And I've seen a photo of some of the artwork, and it's really beautiful. And overall, it was reported that the bus shelters provide a safe and meaningful place for community members, especially students, when they're starting their day, and that this project has assisted in strengthening relationships with other stakeholders in the region, leading hopefully to future endeavors in road safety and transportation projects. Thanks.
Thank you, Joanne. And finally, going down to Fraser Health, my region. And I'm going to talk about a project that we're funding this year in Mission, which is a community just about an hour or so east of Vancouver. This project is interesting because it's a great example of schools and the municipality working closely together to improve safety for school kids and create some of the foundational conditions to encourage more active school travel. And now the epicenter of this work is pictured in this high traffic intersection, which has an elementary school on one side, a middle school on the other, a French immersion school across the parking lot from the middle school, and a rapidly growing neighborhood just up the road, which will be bringing with it more students, as well as an increase in expected traffic volumes. Traffic around these schools was increasingly chaotic when people were feeling unsafe to walk to school. And there have been a number of incidents in which students have been nearly hit by drivers near schools in the district, including an incident a couple of years ago in which a student was actually hit while crossing the intersection in this picture. So 2 years ago, the elementary school next to the intersection was awarded a Vision Zero grant to develop an active school travel plan, to undertake some route mapping and to engage with the school community. This year, we awarded a grant to build on this work and help them move toward a district-wide active school travel plan, mapping routes and developing plans for 2 more priority schools in the district, including implementing walking school buses at these schools. The city was awarded a separate Vision Zero grant this year to make a number of safety improvements at this pictured intersection, including lane channelization, installing delineators along the intersection approach to slow traffic and to support a more orderly traffic flow. They are adjusting the signal phase timing and implementing leading pedestrian intervals, or LPIs, in addition to installing some additional signage. The combined work of these 2 projects working together to support shared goals not only in safety, but also in more active communities, sustainable mobility planning, and creating opportunities for community connection. One of the challenges this project has been encountering has been getting volunteers to lead the walking school buses. Now, this is something we see a lot of with safety actions that rely on volunteer labor, and we'd love to see proposals that try new approaches to addressing this really common problem in program sustainability. Because you can imagine in a school setting, by definition, the parents that are involved in these initiatives that require volunteering, by definition, they age out as their kids do, and these champions, people who are championing these initiatives, can be lost to the school, and it's always a challenge for this continual replacement. So we're open to looking at really interested in inviting new models for making this more sustainable. Okay, so there are some overviews of some of the some project examples. So thanks to my colleagues for sharing highlight projects from their regions. So we just saw some community-driven work that focuses on issues such as speed management, building infrastructure for safer pedestrian crossings, work to help make it easier for children and caregivers to walk to school, and just supporting simple infrastructure like bus shelters to make mobility alternatives to driving more feasible. I hope these examples gave you a sense of the range of projects that this program has supported. As I mentioned earlier, we've funded over 150 projects across the province, and a brief description of all of them is on our Vision Zero website. So I really encourage you to browse them and see if there are elements from work done elsewhere that might help you when thinking about your proposal. So in the final section of the webinar, I want to close with some tips for people who are wanting to apply to the funding program. We fully expect that grant applications will be really competitive this year. And we want to support all applicants so they can put forward the strongest and clearest applications possible. Because this will also help our adjudication committee as they work through applications to make the very challenging decisions on which proposals are selected for funding and which ones are not. And speaking for Fraser Health in my region, we traditionally have more than 3 times as much requests for funding as we have funding available. So it is really a pretty competitive program. So first up, it's very important to write your application to speak to the adjudication criteria. So take the time you need to review the scoring guide that our adjudication committees will be using to assess all the applications. It's available on the Vision Zero website. I've highlighted the location in the screen cap on the right here. So it's just under frequently asked questions. Follow it down, and you can see the link to our scoring guide. On the left, you can see the major criteria that will be applied to all the proposals. These are really similar to criteria used in any public health related grants. Importantly, though, note how the number of points assigned isn't uniform across these 6 areas. So write your application with the scoring criteria in mind. Designing your project and writing your application to make sure it is strong in the areas with the most points will improve your application's ranking in this competitive process. Okay, so just be sure that your project idea and your application focus is hitting on all the points in the adjudication criteria. Oops, pardon me. Okay. Secondly, tell us what the issue you're wanting to address is and why it's important. We want to be clear on these sorts of things. Tell us exactly what you plan to do. Be specific. Help us understand the context of the problem and how the proposed solution would work, and why you think it's the right solution to address this particular problem in your community. Have you considered or tried other approaches? If so, be sure to let us know. Tell us how you plan to get the project done within a year, because a year can go by pretty quick. Ultimately, what do you want to see when the project is completed? How will you measure success? Are there ways you can feasibly collect and summarize local data that can quantitatively show success or failure beyond surveying people about whether they're happy with the project or if they feel safe or not? If you're unsure about how to answer that question around evaluation, there are people who might be able to help you with that. And a good place to start in finding those people is with your regional leads. So please engage with your regional leads in advance before you submitting your application during the developmental phase. Your leads can help you, help potentially connect you with resources to help you with your application. They can provide good feedback on your application, the extent to which it's aligning with Vision Zero principles, perhaps ways in which you might be able to prove it, or they can connect you with people who can. For community organizations and smaller communities that don't have like a transportation department with traffic engineers on staff, your regional lead may also be able to connect you with an engineer who can provide comment and provide some guidance on your proposal idea. One of the questions the adjudicators are going to be asking is, will they be able to do what they say they want to do? So show us your team, because the question is going to be, do they have the right people in place? Do those people have the right skills? Do they have the time to commit to doing the necessary work? Can they do what they are proposing with the funding you're requesting? Funding is really part of a larger resourcing question. So be sure to lay that out too. Like, what about in-kind contributions or community sponsorships or funding that will be committed to this initiative from other sources? If there are any of these other sorts of support commitments, be sure to include documentation like letters, for example, showing that these commitments will be available if the application is successful. It can also be helpful to look outside your organization to build a team. If other organizations, such as a school district or a transit authority or the police, can help with this project, then get letters from them describing what they can bring to support this work. Demonstrating these partnerships may help strengthen your application. We have a budget template in the application that we require applicants to use. We've tried to make it as simple and easy to complete as possible, but be sure to include all the major items in your project so that the adjudication committee can be assured that you've thought everything through and thought about everything that's needed to get your project done. Be sure to recognize the contributions others from either within your team or others outside your organization are providing to the project. This can be these in-kind contributions I mentioned before. Be sure to include vendor quotes for either purchased items or contracted services to ensure that the costs are managed and to avoid uncomfortable surprises. If you find when you go to a vendor and find that what you thought was X dollars is actually quite a lot more than X. And finally, whatever your background, at the end of the day, what we want is for you to tell us your story. We know that we'll be receiving grant proposals from a wide range of applicants. Some will be from large municipalities that have highly specialized staff and have people who often write project proposals as part of their job. They're going to be really professional about it, and they're going to really know how to put together a proposal and complete these templates, and it's relatively easy for them. Some of our applicants will be from small communities that simply don't have these kinds of resources, or even from concerned citizens groups who just know that there's a safety issue in their community, and they want people to be safer, but they haven't written a grant proposal before. So we recognize that there is an inequity in access to grant funding like ours because of these differences, and we want to do what we can to give smaller communities their best shot. So I've just talked a lot about objectives and outcomes and the adjudication criteria, and that matters because it's the framework we need to put around this whole process to make it clear and accountable and fair. But ultimately, these are structures that help us understand the problem at hand and how it'll be addressed. So please follow the tips I provided when you're working on your proposal and make your application your pitch to the adjudication committee on why your proposal addresses an important issue in your community, how it aligns with Vision Zero principles, and why you think your proposed project will make a difference. Basically, we just want to hear your story. So thanks for being here, and thank you for your interest in this grant program. And here's the contact information for the regional leads so you know how to get a hold of them. This information is also on the Vision Zero website if you scroll down to the bottom of the Apply Now page. And so that's it. So thanks everyone. And now we can open for questions and answers.